Hello everybody, welcome to today's video lecture, and we are covering the appendicular skeleton. So let's go ahead and begin. Now your skeleton is divided into axial and appendicular part. Please watch a previous video where we cover axial skeleton, and today we will talk about appendicular part. Appendicular skeleton is made of upper limbs and lower limbs, so that's your arms and legs, and also what we call girdle. We have pectoral girdle that attaches upper limbs to your axial skeleton, and pelvic girdle attaches your lower limbs to the axial skeleton, right? So the pectoral girdle is made of two bones, clavicle on anterior bone and scapula posterior bone. Upper limbs are made of humerus, proximal bone, two distal bones, radius and ulna. Then we have carpal, metacarpal bones, and phalanges. Pelvic girdle is made of hip bone. Another name for hip bone is os coxa or coxal bone. Femur, and femur articulates with tibia, and we have another bone here, fibula, that doesn't really articulate with femur. Then we have tarsal, metatarsal, and phalanges. So let's look at pectoral girdle. And a clavicle is a horizontal bone in your body, and it's only horizontal bone that is a long bone, right? All other long bones in your body are vertical bones. It supports scapula, transmits force to sternum and axial skeleton, and protects nerves and blood vessels. If you look at scapula, clavicle over here, you will see three regions, medial end, shaft, and lateral end. Now, this medial end towards midline of the body form joint with the sternum, and clavicle has what we call it sternal. So instead of medial end, we call it sternal end, right? And a lateral end, we have acromial process or acromial end, and this is where joint with the scapula is formed. Now, scapula posterior side of shoulder, it also anchors your upper limb to the body, and it has several landmarks. So here you can look at the anterior part. Let me make, so I can use my pen, I can draw, see? Okay, so this is our anterior aspect, and this is the posterior aspect of the scapula. And now this is glenoid cavity, and what attached to glenoid cavity is humerus, right? The bone of your arm. Now this is lateral part. That's why we have lateral border over here. So we have a medial border, and we have superior border, and we have suprascapular notch on the superior border. If you look at the posterior aspect, you will see this structure over here that is called spine of the scapula, and it continues into process called acromion, right? There is another process called coracoid process right there. Now above the spine, you have structure called a supraspinous fossa. So let me use my highlighter instead. I think the highlighter would be better. I'm just gonna use yellow one, right? So this is supraspinous fossa. This one is infraspinous fossa. And on anterior side, you can see subscapular fossa. And those landmarks will be important because when we cover muscles, we will learn that above the spine, we have supraspinatus, below we have infraspinatus, and on anterior part of scapula, we have subscapularis muscle, right? So that's the major landmarks of scapula. Then we're gonna move to the upper limb, that is humerus. And it also has several landmarks. So you have a head of humerus, right? So let's see, yeah, so here would be the head. Now this is our surgical neck. We have anatomical neck that is right there. We have deltoid tuberosity, where deltoid muscle is attached. On the distal side of the humerus, we have epicondyles. That's a medial epicondyle. Over here, we don't have lateral epicondyle. Now, this part is called trochlea, and next to it, we have capitulum right there. So capitulum articulates with radius, and trochlea articulates with ulna. Right. So, yeah. So now we're moving to forearm, and we're gonna look at ulna. That is a medial bone, and it has very prominent notch that is called trochlear notch. So over here, that's a trochlear notch, or it's shown on a diagram as well, but you can see trochlear notch way better on human bone over here. It has also this part is olecranon process, and olecranon process, if you touch your elbow right now, you're touching olecranon process of ulna. It has trochlear notch. I already told you about it. This trochlear notch right there or over here, and it articulates with trochlea of humerus. So if you look at the previous slide that we just covered, you see that's a trochlea, but this is a trochlea of humerus. So it's a, it's a bony structure over here that gonna fit inside this trochlea notch. Also, radius and ulna has a membrane that connects them and holds them in place, and it's called interosseous membrane. Inter means between, osseous means two bones, so we have interosseous membrane, and and I already covered olecranon process, right? So radius is a lateral bone of forearm, and it has head of the radius. So I'm gonna maybe highlight it over here or right there. That's the head of the radius, and below the head we have a neck. We have radial tuberosity, that this bump over here. We have ulna notch of the radius. It's right there where ulna, right? So this is ulna notch of the radius, and styloid process of the radius is this bony structure over here. So on the distal side, we have styloid process of the radius and styloid process of ulna, right there. And on the proximal end, we have head of a radius, neck of a radius, radial tuberosity, and we have a membrane again between radius and ulna. Okay, so now let's move to our carpal bones, that's your wrist. And we have 8 total bones. If you look on anterior view, posterior view, right, we're gonna actually start with the let's look at the posterior view over here. And the first bone that is where your pollex is, and pollex is lateral, right? So the most lateral bone, if you're looking at posterior view, is scaphoid. Then we have lunate. Then we have triquetrum, and we have a pisiform. Okay, let me see. So here you cannot see a pisiform because it's kind of sitting on the top of triquetrum. So if this is triquetrum over here, so this is pisiform. So you can see it on anterior view. So you have over here scaphoid, lunate, triquetrum, and pisiform, or scaphoid, lunate, triquetrum, and pisiform seen from anterior view, right? So, so we have 1, 2, 3, 4 over here. And let me pick up a different color, maybe pink. And so this is our proximal row, and distal row we have a trapeze. Oh, it's still yellow. Interesting. I thought I picked up different color. Okay, now. So it has trapezium, then it has trapezoid, capitate, this one right in the middle of your wrist, and hamate. This one right there. So here we have 8 bones. I colored my proximal row in yellow color, right? Scaphoid, lunate, triquetrum, pisiform, and distal row in pink color, trapezium, trapezoid, capitate, and hamate. And when we have our lab, we will look at these bones. We will learn how to identify them. They have a distinct feature that will help you to remember their names and location. All right. So over here, we can see at the at your wrist and carpal joints. So scaphoid and lunate articulate with radius. So if you look at this X-ray over here, this is the radius bone. I hope you can see my arrow. And here we have our, oh, I'm sorry, that's a radius. Yeah, oh, yes, because that's a posterior view. Right, so that's a radius bone. I apologize. So that's a radius bone because your radius is where your thumb is. It's not posterior view, I'm sorry, but yeah, that was just my mistake. So with your radius, if you look at your forearm in anatomical positions, that your palm is facing forward, right? You know where your pollex or your thumb is away from midline of your body, right? So that's a lateral. And where your thumb is, you have your radius, right? So this is your radius over here. And radius articulate with the scaphoid and lunate. And then you have a triquetrum. So you can see over here. Oh, yeah, you can, this is our distal row. So then, so triquetrum articulates with fibrocartilaginous pad. So it will be some pad made of fibrocartilage. Distal bones held together by ligament. And then you have connective tissue kind of that cover your, so it's located on the top of the carpal bones, and it cover all the tendons or cover tendons of the muscles that passing through this area, right? So anyway, over here, right there, we have our, what we call flexor retinaculum. So here's you have your bones, and this is distal row because you have trapezium, trapezoid, capitate, hamate, right? Then you have your muscles. This is called a muscle of thinner group. This is a muscle of hypothinner group. And then you have a connective tissue here that closes up this area, that your flexor retinaculum. And this is what form carpal tunnel. So the name is over here. So flexor retinaculum spans top of this area, maintains carpal grouping, and form carpal tunnel. And you know, some people have carpal tunnel, and that, for example, if they use their computer too much, because we have a nerve over here, it's a median nerve that passing through this carpal tunnel. And when we have inflammation inside, then we might have those tendons pushing on a nerve and it causes pain. That's what carpal tunnel is. It's inflammation within this structure. Right, let's see. Okay, now we're moving to the hand. So here we have our carpal bones. right? So remember, we have 8 carpal bones, 2 rows, 4 bones in each. So if you look over here, you see this bone right there. This is a scaphoid. So scaphoid look like a boat. This is lunate. This is triquetrum. And this is little one is your pisiform, right? So this is your thumb, right? So this is trapezium. This is trapezoid. Right in the middle, probably like one of the biggest bone is capitate, and this over here is hamate. Right, so that's our 8 carpal bones. Then we're moving to metacarpals. Well, good for us that metacarpals, they only have numbers, and we abbreviate them like MC. So that MC1, MC2, MC3, 4, and 5, and we're gonna start with the thumb or pollex, right? So this is MC1, 2, 3, 4, and 5. And then we have phalanges. So you have 5 fingers. Your digits 2 through 5, or fingers 2 through 5, has 3 phalanges, and we call them proximal, middle, and distal phalanges. And the pollex or thumb has only 2 rows, right? Proximal and distal. So the middle is absent, right? I don't have middle phalanx over here. So that's the hand. Okay, now let's move to hip bone. That is pelvic girdle. So hip bone has 3 regions. It has ilium, shown here in green, ischium or ischium, and pubis, right there. So I like this picture because it has 3 different colors. So you can see how those bones are connected. Now this area over here, it's like a socket called acetabulum. And within this acetabulum, you will have your femur. So femur has a head. Head of the femur will fit inside this acetabulum, forming your hip joint. And you can see all the 3 bones are connected within this acetabulum. Now ilium, it tells you here it has greater sciatic notch. So it's right here. We have sciatic nerve that's gonna be passing through this area. Ischium has ischial tuberosity, that is this part right there. So if you're sitting right now, you're sitting on your ischial tuberosity, and it has a lesser sciatic notch right there. And pubic has a pubic arch and subpubic angle. So we would have this angle over here that's called subpubic angle, and it allows you to differentiate between male and female pelvis. Because if this angle over here is 90 degrees or more, your pubic angle, then it's a female pelvis. If it's less, it's a male pelvis. Right. So over here you can also see kind of like we have rami. Ramus means branch. So we have superior ramus, we have inferior ramus, and right, and then we form this pubic arch, right? So that will be arch, and under the arch we have angle. Now, pelvis is made of 2 hip bones plus sacrum and coccyx. So this is our sacrum, and this is coccyx. So you can see that pelvis is a part of axial and appendicular skeleton, because this is our axial skeleton, sacrum and coccyx, and this is appendicular skeleton, that is os coxa or hip bone. So it has obturator foramen. So this is a big foramen where you will see obturator nerve and blood vessel passing through this area, right? So here you can see subpubic angle better, right? Now, acetabulum, we cannot see acetabulum over here, but I will go back to a previous picture, and sciatic foramen we cannot see on this diagram either. So acetabulum, remember, is this socket right there where the femur fits, and sciatic foramen will be formed by those sciatic notch will form sciatic. Yeah, you can see it over here. I'm sorry, because we have those ligaments. So here's our sciatic foramen. It's not the best view, but yeah, this is where our nerves and blood vessels are passing through as well. Okay, so by the way, here's male versus female pelvis. So the differences are in pelvic weight. It's thinner and lighter in females. Pelvic inlet shape is different, round in female and heart-shaped in male. So you can see this is our, highlighted in red. This is our inlet. So it has lesser pelvic cavity. So it's shorter and wider in a female. Right. And subpubic angle, so it says 80 degrees, in some books you will read 90 degrees or more in females, and less than 90 degrees, or here is 70 degrees in males, and pelvic outlet shape rounded and larger in males. Right, so there are many differences between male and female pelvis, and those differences are related to the main extra function of female pelvis, that is bearing a child and giving a childbirth. All right, so both female and male pelvis support a weight of your body, allow point of attachment for your lower limbs, right, allow movement, it protects your internal organ, but female pelvis has extra function. So when the female goes through the labor, it needs to be the pelvis inlet and outlet need to be larger, more rounded, less abstracted compared to male, right? And that's also related to this subpubic angle. So that makes our inlet and outlet larger in the diameter when we increase the subpubic angle. So usually when you look at the angle, it might be enough to distinguish between male and female pelvis. But if you have doubts, then look at the shape of inlet, if it's round or it's more like a heart shaped. Now we're moving to lower limb, and the first bone is femur. Longest, the strongest bone. It has a head, right? So here you have a head, you have a neck. This is actually anatomical neck, the one that I showed you over here. Then it has fovea capitis that you cannot see over here, but it will be right there, where we have a ligament attaches, right, that holds your femur within this acetabulum. It has trochanters. So this one is a greater trochanter, and over here is lesser trochanter. Gluteal tuberosity on the posterior side, where gluteal muscles are attached. Linea aspera is on the posterior side as well, and it's also point of attachment for some muscles. Now patella is over here, right, and it fits in the patella surface of the femur. It's sesamoid bone, and it's within tendons of quadriceps femoris. So we will have four muscles in this area, right? Four muscles, and collectively they are called quadriceps. So they will have a tendon, and within this tendon you will find a patella. Now tibia and fibula. Tibia medial, fibula is lateral. Tibia is larger of two bones and it's main weight-bearing bone of lower leg. So it has condyles. So here we have lateral condyle, here we have medial condyle. Tibial tuberosity right here. Medial malleolus, this bony structure on the medial side, and it has a fibular notch, right? That's gonna be right here. Fibula is lateral, smaller bone, doesn't have direct connection to femur. It has some muscle attachment, not weight bearing. Head and lateral malleolus is right there. Tarsal bones, we have 7 of them. So if you look over here, that will be our talus. Right, a talus, or you can see talus. You can see talus on all of this picture. I'm just trying to, maybe here's a lateral view. So here's a talus, and talus will articulate with tibia. It's the most superior bone. Calcaneus is the largest bone, and that's your heel. So here's your calcaneus right there. That's your heel. Then we have a cuboid right there, and navicular, and then we have 3 cuneiforms, right? So we have so that's your big toe over here, and if you look at your big toe, you know it's gonna be medial, right? So that's your so this is your cuneiform 3. Oh, here. 1, 2, 3, right there. Right, so 1, 2, 3. And because this is a medial, on the medial side, we have medial cuneiform, we have intermediate cuneiform, right, and we have lateral cuneiform. Okay, so 1, 2, 3. So that's your talus, this is your calcaneus, this is your navicular, and this is your cuboid, right there. Then we have metatarsals. We abbreviate metatarsals MT 1 through 5, and we're gonna start with the big toe or hallux, right? So here's your big toe right there. It's a distal, so proximal is your MT1, MT2, 3, 4, and 5. However, we do use like Roman numbers instead of just regular 1, 2, 3, 4, and 5, right? And then phalanges, similar to phalanges on your hand. You have digits 2 through 5. Those digits have proximal, middle, and distal phalanges. So right there. And the big toe has only proximal and distal phalanges. All right, and we're gonna end up, we're gonna end this lecture. Yeah, we end up with ossification. I'm sorry for this. We're gonna end this lecture with some information about bone formation. And bone formation is called ossification. So if you imagine during embryonic development, if we start with a one single cell and cell divides, you know, and we probably cannot form bones right away, and we don't. So either we form a membrane, connective tissue membrane first, and then this membrane ossifies, it became a bone. And then this is called intramembranous ossification. So if you have membrane and you start ossification within this membrane, it will be intramembranous ossification. Or you're gonna start with cartilage, hyaline cartilage, and then cartilage will ossify turning into a bone, then we call it endochondral ossification. So all bones of the appendicular skeleton, except clavicle, are formed through endochondral ossification. That means that first we have a cartilage precursor. Those bones are made of cartilage first, and then they changed into bone. So all bones below your neck, really, with exception of clavicle. Intramembranous ossification happen, as I already told you, when you have membrane first, right? And your flat bones of the skull, mandible and clavicle are formed through intramembranous ossification. Now, actually, everything begins with mesenchymal cells. So mesenchymal cells are stem cells, and they will differentiate either into hyaline cartilage, right? And then from this hyaline cartilage, we will form primary and secondary ossification centers and bones. Or mesenchymal cells will differentiate directly into osteoblast, into bone cells, and they will replace membrane by bone, right? So that's ossification of bones very, very quickly. In the physiology part, we will talk about ossification in more details. So that's it for this chapter. It was appendicular skeleton. Thank you for watching, and I hope it was helpful.